Hello, my name is Jessica Shipley. I am a registered dietitian and a certified diabetes care and education specialist. I have been with Stanford for more than 10 years now. I see patients in our nutrition clinic where I teach weight management classes and also diabetes classes. One of the recurring questions we hear from our patients are, how do I read nutrition facts labels and how do I interpret that information? Today, I'm going to walk us through how we can do that and learn how to apply that information for portion control and carbohydrate monitoring. I want to highlight here, this is called the new label. The Food and Drug Administration has updated the nutrition facts label based on some updated scientific information, nutrition research, as well as input from the public. A couple things that are new on this label are that calories and serving sizes now appear in larger font. There is something called the daily values and serving sizes. Those are also updated. And then added sugars, vitamin D, potassium are now listed and including the amount in addition to the percent daily value for vitamins and minerals. And we're going to go through these things in detail today with a focus on the carbohydrates. We start reading a nutrition facts label at the very top where it says serving size and servings per container. In this example, what it's telling us is that the serving size is 2/3 of a cup and there are 8 servings per container. If I eat 1 serving, which is 2/3 of a cup, that means all the information below is what we are going to be consuming. If I eat 2 servings of this specific food, then that means I'm going to double all that information below because I'm eating 2 of that serving size. I recommend for our patients or for anyone who's new to looking at the labels and wondering about the serving size is to actually measure it out to see what does a 2/3 cup of this specific product look like or whatever it is that you have in mind. And that really helps us to better interpret that information and be able to eyeball what it is that we are going to be eating and consuming. Next, we can look at calories. The amount of calories recommended per person is very, very individualized. You may have heard or have seen or read that 2,000 calories a day is recommended, but that's really used as a general guide for nutrition advice. Your calorie needs could be higher or lower, and that depends on many factors, including your age, your height, your weight, gender, physical activity level, and of course, your nutrition goals. Are you trying to lose weight or trying to gain weight? But in this example, the calories are 230 calories for every 1 serving, which is 2/3 of a cup. Next, we can look at something called percent daily value. That is this column here on the right-hand side with all these percentages. The percent daily value shows us how much a nutrient in a serving of a food contributes to the total daily diet. A general guide is that something that is 5% or less of a nutrient means that's low, and then something that is 20% daily value or greater means that that nutrient per serving is considered high. More often, we want to choose the percentages that are high in fiber, vitamin D, calcium, iron, and potassium. More often, we want to choose foods that are lower in saturated fat, sodium, and added sugars. We're going to spend a little bit of time now because we are focusing on those carbs. And this is where I want to highlight a lot of information here. So we're going to look at total carbohydrate next on the nutrition facts label. Total carbohydrate, in this example, it says 37 grams for every 2/3 of the cup. What does that mean? Well, that total carbohydrate, 37 grams, includes everything that can be broken down into glucose. That's going to include our starches, our fibers, added sugar, and naturally occurring sugars. Below total carbohydrate, we see fiber. And in this example, we have 4 grams of fiber for every 2/3 of a cup. A few notes on fiber is that fiber is a non-digestible carbohydrate and will not raise blood sugar. In this example, the fiber is 14%, and we want to try to choose any of those that are higher. But thinking from the context of how many grams a day that are recommended, it's recommended to have somewhere between 25 to 38 grams of fiber a day. So we want more fiber. One of the common questions that we get from patients are, tell us about these net grams of carbs. What does that mean and how does fiber play a role? There's a couple little things that I'd like to share with you about fiber is if you are counting your carbohydrates, one thing that we could do is if a product has 5 grams or more of fiber, you can actually subtract half of that amount of fiber from the total carbohydrate grams. And you can use that total carbohydrate amount for counting your carbs. In this example, this product doesn't have more than 5 grams, so I would just say we would just count that 37 grams of carbs. There is another term that you might see labeled on the front of food packaging listing the net grams of carbs. I want to point out that there is not a legal definition for net carbs, and it's actually not, that term's not used by the Food and Drug Administration, nor is it recognized by the American Diabetes Association. However, products will claim that it has a certain amount of net grams of carbs, and the way they do that is by subtracting all of the fiber and all of the sugar alcohols from the total grams of carbs. So there are some different ways to calculate net grams of carbs or look at these carbs. It's really based on the individual. Everyone is very different with managing their blood sugar. You may reach out to your dietitian if you do want some more individual guidance on that. The other thing that we want to look at, below the total carbohydrates, we see fiber, and then we see another row that says total sugar and then added sugar. That added sugar row is really insightful because in the past, we were never told as a consumers how much sugar is actually added to the product. What this added sugar number means is it's telling us the amount of sugar from external sources, which could include things like table sugar, syrups, honey, agave syrup. In this example, of the 37 grams of carbs, 10 grams of carbohydrates have been added. To put that in a reference, 1 teaspoon of sugar is 4 grams. And in this example of 10 grams, that means we're getting about 2.5 teaspoons of sugar here. I'd also like to point out under this added sugar row, we can look at the percent daily value, and that says 20%. Remember that things that are 20% or more are considered high. And we want to limit that. We want to limit those numbers with the added sugar, especially in the case when we're trying to really optimize our blood sugar control. These types of added sugars turn into glucose really fast in our body. And when we want to watch our blood sugars, we want to do our best to limit those the best that we can. So when we think about those carbohydrates, why is it so important to look at the total grams of carbs on the nutrition facts label? It's because they all will impact our blood sugar, and by being aware of the amount of total carbohydrates in our foods is really going to help us to manage our portions and ultimately better manage our blood sugar. The amount of carbs that are recommended, again, is very individualized, but a place to start where many of us fall into this range are aiming to have about 30 to 60 grams of carbs per meal. That means 30 to 60 grams of carbs at breakfast, at lunch, at dinner. And then if we snack in between those meals, aiming for somewhere between 0 to 30 grams of carbs for snacks. Of the carbs to choose, we want to focus on the minimally processed carbs. These are going to be our whole grains that have more fiber in them, fresh and whole fruits and vegetables, beans, peas, lentils, dairy without the added sugar. And then the ones we want to limit would be the ones that are considered to be refined carbohydrates and have lesser nutrient value. The sugars, the honeys, corn syrups, refined types of grains, and sweets. So as we're looking at the labels, the steps we're going to take as we put all this together to identify our carbs and our portions are to first look at the serving size. Then second, we're going to go down, we're going to look at those total carbohydrates. We may take a look at that fiber, look how much added sugar is in the product. And then we're going to compare that amount to what we are eating or what we plan to eat, compare that to that amount that we're thinking about having, and then count our carbohydrates accordingly. So in summary here, we want to use our nutrition facts labels to help us make informed carbohydrate choices. And ultimately, that's going to help us to better monitor the type of carbohydrate intake and our portion and help with blood sugar management. If you are interested in learning more about nutrition facts labels, here are some additional references for your review. And remember, you may always reach out to a registered dietitian for further individualized recommendations. Thank you.